I'm going to pick one more controversial topic here, and something that comes up frequently as well is pregnancy and FOP. And are there any risks or are there precautions that should be considered?
Yes, pregnancy and FOP is a very serious matter. In fact, it was addressed recently in a wonderful series of articles in the FOP Connection by Jeannie Pieper, Nancy Sando. Dr. Shore and I wrote a medical piece, a medical and scientific piece about the potential risks of pregnancy, and Dr. Ruth Westheimer wrote a wonderful preface to this series of articles that our membership and others who are interested can access online, I hope, and through the FOP Connection itself. But pregnancy and FOP is a pregnancy in anybody, any family that's thinking about having children. Those are some of the most important and serious matters I think a family can consider. But above and beyond what they are for any family, there are serious health implications for patients who have FOP, especially women who have FOP. Now, in the multi-generational families that have been so critical in our identification of the gene that Dr. Shore has talked about, there's only one where FOP was transmitted from a mother to a mother who had FOP to her children. There are other examples that we're both aware of in the world where a mother who has FOP has passed FOP on to a child, one child. Those are not helpful in our gene linkage studies, but right. That has happened. And other times where women who have FOP have passed it on to have not passed it on. There's a 50% chance that anybody right. with the condition could pass it on. But the risks are that there's a 50% chance that someone who has FOP could pass the gene on to a child. There's also the there's risks to the mother and there's risks to the children. Now the risks to the child are that the mother may not be able to carry the pregnancy through to the full term, so the child will be born premature. The child may not have room to grow because of the limitation the limitations due to FOP. So the child may have to be born prematurely. The child will have to be born by cesarean section because a mother who has FOP cannot safely deliver a child vaginally. And with the cesarean section, there'll have to be anesthesia given, which of course can have implications for the baby as well. Now these also have implications for the mother. There can be flare-ups of FOP during pregnancy, and how will they be dealt with? What will happen if medications need to be given for flare-ups? Will the mother be able to carry a full-term pregnancy? Because the abdominal wall may be affected with FOP bone, the baby may not be able to expand. And so the baby will press up on the diaphragm, causing further restriction in the mother's breathing, which can cause distress to the mother and further distress to the baby. So there's a whole host of considerations that are outlined in the articles that Dr. Shore and I and others wrote that are accessible that our membership can read about. But these are very, very serious considerations. It doesn't mean that these are prohibited. These are decisions that each individual and each family have to make for themselves. But they're medical concerns that go beyond social concerns as right. well, that need to be thoroughly discussed with individuals, physicians who have knowledge about FOP and what the implications are to the mother and to the child and to the new family of going through a pregnancy.
Certainly something that should be very, very carefully considered. Well, thank you for sharing those insights with us.